Self-awareness and consciousness of actions. Be aware of what you're doing. Know your assumptions, know your stereotypes, and I think real important, understand your own comfort level. How comfortable are you talking with someone from a different country? How comfortable are you working with a patient who has HIV/AIDS? How comfortable are you working with a person who maybe has a mental illness, is not even aware of what they're doing? You have to determine your own comfort levels. Secondly, listen with respect. Remember to give the person your full attention. I can remember in my previous life as a social worker oftentimes spending half hour to an hour with an elderly person who just wanted to talk about their family experience, everything about telling you about their grandchildren, their great-grandchildren, and every ache and pain they had. And sometimes it's really hard to listen with respect when you're worried about what you need to do in the next 5 minutes. So again, be respectful to that individual, be courteous, and try to have patience. The third thing is to develop cultural specific awareness. You need to be, as I had said to you before, have some knowledge of cultures, understand that certain taboos or values, beliefs, or mores are important to a culture. That helps if you can educate yourself. That will again help you create an awareness. And it's important as well to develop your own cultural awareness. And the fourth one is to treat people uniquely. Don't assume anything about anyone. Treat the person as an individual, take them where they're at, and focus on what their needs are at the time. Next, seek out information. As I mentioned before, it's okay to ask questions. Sometimes you may have to go through a series of routine questions that you need to ask, and sometimes you may need to explain to the individual that this is part of what you need to do in order to give them the best care possible. That's okay to seek out that information. Next, tolerate ambiguity, or what I'll call uncertainty. Things may not be as clear-cut as you'd like them. You just need, again, to be patient and flexible. Next, establish trust and show concern and empathy. And I've kind of highlighted this before, but again, establish a rapport, establish trust with your patients or those clients you're working with. Over a period of time, that will especially help you to develop the best care. They will feel more comfortable with you, they will share more of their experiences, and again, bottom line, help you deliver the best care possible to them. Show sensitivity to privacy and embarrassment. Sometimes, especially for working with people from different cultures, they are going to be very private. They are, again, going into a gender issue, not going to be comfortable with maybe a male caregiver working with them. Be patient again. You may need to bring in, if you're the male caregiver, bring in a female caregiver to kind of facilitate the work with you. Okay? Next, have a sense of humor and patience. I think that's those are one of the most important things. You have to be able to laugh at yourself and not take things so seriously. Again, being a caregiver is very important, but at the same time, if you have a sense of humor, if you have patience, that will come across in dealing with the people you're caring for. Be aware of nonverbal messages and cues. Be aware sometimes if the person is telling you that they're doing okay, everything is fine, maybe some of those nonverbal messages they're giving you aren't matching up. Or maybe you are delivering some kind of different message based on your gestures, your body movements, those kinds of things. You need to be aware of those nonverbal messages. Next, listen for the hidden meanings in conversations. And this kind of goes back to what I was just saying. You may need to ask for clarification on some things because something may not be matching maybe when you're talking with the individual, what they're saying, how they're acting, or some of the other things that are going on in the context of the situation may not match. And there may be some underlying hidden messages here that you need to be aware of. So again, it's okay to ask for clarification of what's being said or what's happening. Avoid jargon. Oftentimes in healthcare we deal with technical terms. We sometimes use acronyms or abbreviations for things. It's easier for us. We're more familiar with that. Remember, people may not always understand what you're saying or what you mean by those things. You may need to go back and explain. You may need to draw a picture to help them understand a little bit more what you're saying. So again, Avoid that jargon and those technical terms, especially dealing with patients and the elderly, I would think. Finally, put yourself in the other person's shoes. I think it's always valuable to say, what would I want to have done to me? How would I want to be treated if I were in that person's shoes? If you were the person lying in that bed, how would you want to be treated? What would you want to have done? What kinds of things would you want to have said? And again, how would you want them said to you? Bottom line, think in a way of customer service. You need to put yourself in that other person's shoes. So those are some of the strategies I think that will help you really develop some great cultural competency skills and to be able to effectively communicate across cultural lines. So in summary, I just need to say, one cannot become culturally competent after just one training session like we've had today. It takes hard work and must be integrated into your personal and your professional life. It's a process. It's a way of life. Thank you for your attention and good luck.